All right, so we are here going to go through your 2020-2021 open enrollment presentation. So thank you for tuning in. The University of Tampa will have open enrollment from February 10th through February 21st. So starting next week, you'll have just under 2 weeks to make your election. This year, we're excited to welcome our 27 members to our 18th annual ICUBA open enrollment. So shown on the screen are our other member institutions that are in this open enrollment period with you, and we hope that you gain a lot of information from this presentation. A sneak peek of what we're going to be reviewing today. We're going to focus on what's new for April 2020, a low increase to the medical premium, the Rally program enhancements with the introduction of a brand new physician results form, an increase on the flexible spending limit, the dependent verification review, and then we're going to tell you how you can be entered in to win sweepstakes for a prize. We're also going to review some of the same great benefits that will be continuing. These benefits will not have a change this year. Some of it is just a reminder and a refresher, and then we will finish out with some open enrollment housekeeping items. So last year we talked to you guys about how ICUBA is a self-funded medical plan, which means that all claims processed by the medical, pharmacy, and behavioral health benefit managers, those benefit managers process all of the claims. And then they ultimately send ICUBA the larger bill, and we pay that bill for your claims with the premium dollars that you guys contribute through your paycheck. So we wanted to remind you that all premium dollars are saved for the exclusive benefit of our members, and premium dollars are only spent on the benefits that you guys are receiving. So all those claims, all those doctor's visits, that's what your claims dollars are going towards. Our plans are specifically designed by educators for educators. We meet monthly here in Orlando, where ICUBA are headquartered. We meet monthly with all of our members, and we really go through all of the plans and vet out what is working and what is not working. And we make some enhancements where they can be made. One enhancement that we're excited to introduce this year is to that Rally program, so stay tuned for more information on that. ICUBA really wants to invest in a long-term culture of well-being, not only within our institution, but on your campus as well, so you can be the best version of yourself. So this year, thanks to your good use of the plan, we're pleased to bring our members a low increase for the coming plan year. Moving into Rally, the BlueRewards powered by Rally program received some enhancements this year based on the feedback provided by you. The Rally survey will still be the gatekeeper, so that is still the #1 thing that you need to complete after April 1st. And that just opens the gate to give you access to all those gift card incentive dollars that you've earned. Highlighted in red, these are the enhancements that we've made to the program. The wellness exam will increase after April 1st to $60 from the current $25. The biometric screenings will also increase to $40. And then those on-site campus events that are sponsored at UT, you will have the ability to earn up to $70. So those will remain at $10 each, but you'll have the opportunity to participate in up to 7 for that incentive. The preventive exams are still available, so a PSA, a colonoscopy, or mammogram, the very first claim process will receive a $50 incentive. And you can also contact ICUBA Cares to see if you qualify for one of those qualified medication changes for that $50 incentive. We still have coin options available through missions, city challenges, teledoc registration, tobacco attestation, and clinical rewards. We heard some noise last year like, oh, the coins are great, but I don't really know what to use them for. So I would just give you a pointer and tell you to keep your eye out for those flash sales. The flash sales are always great. You can get great discounts on movie tickets or theme park admission, stuff like that. The other really cool feel-good fact that we learned last year is ICUBA members are donating their coins. So ICUBA members across all of our institutions donated more than 4 million coins to charity last year, which is pretty phenomenal. So new this year, we're introducing the physician results form. There's no more additional finger pricks or additional blood draws that will be required. So starting in April, ICUBA members can get credit for the biometric screening just by visiting your physician. Currently, you visit the Quest Diagnostics portal to register for your on-site biometric screening. So you will still visit the same portal, step one, visit the Quest portal to schedule where you would normally schedule your meeting. You will now be able to print out the physician results form from that page. Again, this is only available beginning in April. From this home screen at the Quest portal, you will download a unique form. This form contains date ranges and a unique barcode to you, the employee, or your covered spouse. So don't make multiple copies of this form. Don't share it with your friends. This form is only for you. Then step 3, when you complete your annual wellness exam with your physician, when they run all that fun blood work once a year, you just need to take this form with you and have them fill out that bottom portion that has the red circle around it. From here, your biometrics can be reported directly to Quest. The last step and the final step to make sure that you get credit is your physician will fax the form back to Quest Diagnostics. The phone number to be faxed is listed right at the top of the form. But what we're suggesting to our members is, in case your doctor's office loses the form or forgets to fax it in, we're always encouraging the members to request a copy of the signed form. So if you notice that you are not receiving your credit, you can take matters into your own hands and either upload the form or fax it in on your own. We're really, really excited about this new physician results form, and we think it will bring a lot of versatility to our members. A few Rally reminders: clinical rewards for chronic conditions is still available. So if you log into Rally and you're provided some educational materials based on one of the conditions outlined here, it's just giving you some educational materials to try to get you a little bit more engaged in the condition that you've been identified with. Not everyone will have this on your screen. You must be diagnosed with one of the conditions that are listed. But if you participate in the educational activities, reading articles or contacting a health coach, Rally will incentivize you with coins throughout the year, and there is a quarterly goal that you can reach each quarter. We will be continuing the city challenges and private sweepstakes. So city challenges are the most fun for everybody. That's where you join a city challenge and walk across various cities in the United States. You sync your tracking device regularly, and every time a milestone is reached, you're automatically entered in to win that Amazon gift card. An Amazon gift card is given away every 14 days, and there is not a limit on how many times you can win. So the other options for private sweepstakes are completing that survey, the other challenges that are available, and also the mission. So we wanted to review some of the values of the improvements for the Rally program this year. I'm sure you guys are all familiar with Emma, so we used Emma as our example in this scenario, and we hope by the next open enrollment that this will be her story. Emma would have downloaded the Blue Cross Blue Shield mobile app and was able to locate a Blue Cross or a Blue Distinction Total Care provider. She got her annual physical or wellness exam at her Blue Distinction Total Care provider for free and earned $60 from that visit. Her primary care physician was also able to submit the Quest physician results form, earning her an additional $40 for her biometrics. So just from that single visit, she was able to earn $100 in electronic gift cards. At work, Emma participated in 5 on-site events totaling $50. And since we increased them to 7, she's hoping for 2 more. During a recent doctor's appointment, Emma was diagnosed as a diabetic. Since then, she connected with a Blue Cross Blue Shield coach through the Clinical Rewards program, and she's gotten a little bit more detailed information on her condition to help her control it. At this time next year, Emma has earned $150 Rally dollars that are redeemable for those electronic gift cards within the marketplace, and has donated 8,000 coins to various Rally charities. So already at this time next year, she is, far ahead of the game. just by doing the stuff that she would normally do every single day. If you notice, Emma did not do any preventive exams, and she did not need to qualify for a qualified medication change with ICUBA Cares. So if those are available to you, the sky is really the limit when it comes to rallies. Just a reminder, flexible spending elections are required each year. So the mandatory elections for this year are the healthcare flexible spending account and the dependent care flexible spending account. Just as a reminder, the University of Tampa will still be contributing to your HRA. So that is on the right-hand side of the screen, and that is just a reminder. I'm sure you guys are all very familiar with the HRA. Just to review the healthcare flexible spending and the dependent care flexible spending in a little bit more detail, these two accounts are funded by the employee, you as the employee. They're deducted pre-tax throughout the year. There are a few differences between the two as well. The healthcare flexible spending the full amount will be available for immediate use on April 1st, 2020, and can be used for eligible healthcare expenses for you and your eligible dependents. If you're enrolled in the ICUBA medical plan, the funds are used from your FSA before they're used from your HRA, because the HRA will roll over each year. The new IRS limit for the FSA went up $50 this year, so the new maximum is $2,750. Moving over to the dependent care flexible spending, these funds are deposited each pay period. So as you contribute the money to your dependent care flexible spending on a pre-tax basis, they will be available for you to pay the various daycares, aftercare, gap care, any child care service that you're utilizing. Dependents, you do need to be mindful of the age for dependents. This can be used for the care of dependents under the age of 13. So if you have a dependent turning 13 in the middle of the year, just keep that in mind when you're budgeting for this account, because they can only use funds until their 13th birthday. The IRS household limit for the dependent care will be $5,000 for this year. It is important to note that both the healthcare flexible spending and the dependent care flexible spending are both use it or lose it with no annual carryover. So we hope that you will please plan wisely when budgeting for these accounts. Dependent verification is still part of the open enrollment period. We hope that you are going in and reviewing your benefits and also verifying that the dependents that you have enrolled are in fact yours. If you have a dependent that is not eligible, we do ask that you remove them during the open enrollment period, and their coverage will terminate as of March 31st, 2020. We know everybody listening reads all of the fine print before you hit that final submit button, but in case you missed this paragraph, it is included in the enrollment portal. You are certifying that all the dependents enrolled on your plan are in fact yours. So you might be wondering, who is an eligible dependent? Your legally recognized spouse, natural child, legally adopted child, stepchild, a child required to be covered pursuant to a qualified medical child support order, a child with proof of legal guardianship who resides with you, or a foster child. These are the only dependents that are eligible on the ICUBA plan. A child can remain on the plan until the end of the calendar year in which they turn age 26, and beyond that if they are totally disabled. So if you have a disabled dependent beyond the age of 26, you just need to submit the documentation of their disability and have it approved, and then they can remain on the plan. So this year, beginning on Monday, you will go to ICUBAbenefits.org to make your elections or confirm your benefits. During this open enrollment period, you're free to update your benefits for the coming plan year as you see fit. The plan year will be, just as a reminder, April 1st, 2020 through March 31st, 2021. The only other time that you will be able to make changes to your elections for the plan year is if you have a qualified life event. And with a qualified life event, such as the birth of a baby, adoption, or marriage, then you have an additional 30 days after that life event to make changes. So when you log into your ICUBA benefits portal, there will be a button at the top that just says Start Your Enrollment. Click on that button, and then you'll proceed through the steps of your enrollment options through the employee information, your benefits, and then you're gonna finalize your enrollment. There is an orange Continue button that you can just proceed through your enrollment. And then when you get to the final view, print, or email, you know that you've completed everything. If you shut Emma off in the beginning, which many people do, don't worry. She will be available if you have questions for her as you proceed through your enrollment. We are hosting another open enrollment sweepstakes this year. So if you log into ICUBAbenefits.org, we're just asking that you confirm your personal phone number and your personal email address. Once you finalize the enrollment process or get to the screen where you can print your final enrollment, you'll be automatically entered to win. So ICUBA really wants to improve access by eliminating barriers to care. It is really important to be an educated healthcare consumer and understand how your plan pays for covered services, especially before you're in the doctor's office. The ICUBA medical plans are specifically designed to remove barriers to care by offering plans where the deductible only applies to major services. So we're going to go through this in a little bit more detail and really get into how ICUBA breaks down those barriers. One of the first ways that ICUBA breaks down barriers is through our benefits portal. So we have this special single sign-on section that's located under the rotating banner under My Carrier Account. In this section, you'll see links to the MasterCard, Optum, Blue Cross, Aetna, and Humana and IMED. From here, you can click into and easily get to all of our brand partners or our insurance carriers. If you've never clicked on these links before, you will be required to set up a username and password, but only the very first time that you click in. The next time that you come back, it will automatically log you in with no extra steps. This screen helps visualize what is at no cost to you, the services that do not apply to the deductible, and then we outline some of those major services that will always apply to the deductible. So on the far left-hand column, the no-cost access, all of the benefits listed on the far left will always be free to you, including Blue Distinction Total Care primary visits, in-network annual wellness exam, medically necessary labs at Quest Diagnostics, Surgery Plus non-emergent surgeries. All the items in the left column are always free. In the middle column, these services do not apply to the deductible. So a co-insurance or a copay may apply for the services in the middle, but never the deductible. So advanced imaging, chiropractic, emergency room, office visits, physicals, prescription drugs, therapy visits, teledoc, urgent care. These are some of the items that are not subject to your deductible. The deductible does only apply to major services, so durable medical equipment, home health care, any type of hospital stay would be major, so that would always be subject to the deductible. Inpatient rehab, prosthetics, ultrasounds, stuff like that will always be subject to the deductible. And these can be found in greater detail on your Blue Cross Blue Shield summary of coverage. Surgery Plus was probably our most popular benefit that we rolled out last year. The Surgery Plus benefit is paired with the medical plan, so it is not an additional election that you have to make. If you're enrolled in the ICUBA benefit plan, by default, you're automatically enrolled in the Surgery Plus offering. The Surgery Plus brings to us their Surgeons of Excellence network. These surgeons are licensed, board certified, fellowship trained, and they've been screened for malpractice, sanctions, and criminal records. They go far and above what the other insurance companies do in order to hone in on this Surgeons of Excellence network. They cover hundreds of medically necessary but non-emergent surgeries. A few of them are listed on the screen here in the bottom left-hand column. But you know, if it's a medically necessary surgery and it is non-emergent, meaning something that you can plan for, these are great reasons to call Surgery Plus and at least get more information. There is a financial incentive to you as the member when going through Surgery Plus. If you decide to proceed with a surgical procedure through Surgery Plus, your deductible and co-insurance are waived. So the procedure is at no cost to you. If travel is required, there is a travel benefit available. So your room and board, potentially, your gas and food are also at a per diem. So they will send you a credit card that will be preloaded ahead of your travel, and it will literally be at zero cost to you. There are care advocates ready to answer your questions. So if you are in need of a non-medically necessary but non-emergent surgery, we encourage you to give Surgery Plus a call. They do have a full concierge service available to help you. They can locate the best fitting surgeon for your needs. They can once you identify the surgeon that you'd like to proceed with, they will schedule appointments for you and coordinate medical record transfers, and then schedule follow-up as needed. Teladoc is also available for just a $5 copay. This is telemedicine or video consultations available anytime, 24 hours a day, 7 days a week. So if your doctor's unavailable, you don't have time because you're at work and you feel like you're coming down with a sore throat, you're on vacation or business travel, these are all great times to call Teladoc. The top diagnoses are listed here on the screen. These are just a few of the reasons why you would call Teladoc, but if you notice, these are all more minor instances of an illness. Teladoc can also prescribe medications as needed, but keep in mind that if you have a backache, they're not going to be able to write you any painkillers or controlled substances. So keep the reasons why you're calling Teladoc to those more minor illnesses like allergies or nasal congestion, stuff like that. Sore throat, cough, those are all great reasons to call Teladoc. ICUBA Care's Pharmacist Advocate Program. This program has been helping people for the last 2 years. We've heard really great things about it. So just as a reminder, if you're having side effects from a new medication or you just have questions about your new medication, if you ever denied at the pharmacy for a prior authorization and you misplaced the letter that Optum mailed to you, if you were ever told that you needed to try step therapy before you can take a certain drug and you just don't really know what that means, or if you just simply want to learn how you can save money by switching to a generic. These are all great reasons to call ICUBA Cares. The ICUBA Cares team is available Monday through Friday during normal business hours. The phones are staffed by real pharmacists that can really advocate for you and provide real solutions to your questions or problems in your individual situation. Condition management is also still available through Aetna through the Able To program. So if you have or if you're taking care of if you're a caregiver situation for somebody that has one of these health or life situations, these are all great reasons to contact Aetna and be enrolled in their Able To program. The Able To program allows you to meet through a web-based meeting of either video conference or telephone. You do meet twice a week for 8 weeks. We meet once with a therapist and once with a behavior coach. These two people come together and really help you identify goals and tackle those emotional challenges that come with these health and life conditions that are outlined on the left. We've heard really great things about this program, and not only does it help you for the 8 weeks that you're enrolled, the items that you learn during the Able To program you can take with you and you will use years down the road. If you ever receive a call from Blue Cross Blue Shield, Optum, ICUBA Cares, or Aetna, don't worry. They're not calling because you're in trouble. They're calling because they care. These are trained healthcare advisors and registered nurses, and they're calling to provide tools and education and help advocate for you and help you manage your chronic health condition. Through this, they can assist you with goal setting and help you better understand your doctor's treatment plan. They really just want to be a support system for you and really help you through any chronic health conditions that you're struggling with, because we know none of it is easy to deal with on your own. Also, if you leave a doctor's office and you have several questions, you can save those questions, and the registered nurses and health advisors are great people to bounce those questions off of. Just a reminder, free visits at Blue Distinction Total Care Provider. So if you're in the market for a new PCP, when you're searching on My Health Toolkit's website for an in-network doctor, make sure that they have this designation, because all medically necessary services received by a family practice internal medicine, or pediatrician with this designation of Blue Distinction Total Care are always free. So rather, if you're going for a wellness exam or you have a sore throat, every visit to a Blue Distinction Total Care primary care provider will always be $0. Just a reminder that Care Connected is in your corner. Care Connected is the brand of the Blue Cross Blue Shield customer service. We rolled this out a few years ago, and we've heard really great things. This number is listed on the back of your ID card next to customer service for Blue Cross Blue Shield, and they can help with claims questions, they can assist you with billing, they can even help you find one of those Blue Distinction Total Care providers I was just speaking about. They can also get you set up with either lifestyle coaching or the chronic condition coaching as well. My Health Toolkit mobile app, we also highlighted this previously. Just as a reminder, this mobile app is like having Blue Cross Blue Shield in your pocket at all times. A really cool feature that I use frequently is having my ID card saved to the home screen. So after you log in the first time, you can give the app permission to save your ID card straight from the home screen. So if you're in your doctor's office and you don't have cell service, don't worry, you can still access at least your ID card without even having to log in. The other features that come with this app is you can pull up your benefit summaries straight from the app, and you can also view your explanation of benefits. So if you go into a doctor's office and they say, oh, hi, you owe us $25 today, you can double check, or like from your last visit, you can double check right in the mobile app and pull up your EOB and make sure that they are telling you the correct thing. This is updated with real-time data. So as soon as the claim is paid, it will show on your explanation of benefit. The Employee Assistance Program is still available to everyone at the University of Tampa. You do not need to be enrolled in the ICUBA benefit plan to have access to the Employee Assistance Program or even be benefits eligible. Some of the key points that they help our members on are listed on the screen: emotional, life, legal, and financial, although there are a multitude of other reasons why you would contact the EAP for help. The emotional is probably the most popular. This is where it gives you 6 free sessions per issue per year for each member of your household. So if you have parents with you, living with you, or a niece or nephew living with you, as long as they're living under your roof, they're also eligible for that emotional support. The life items is like having a personal assistant. So if you just need somebody to help you access retail, entertainment, travel, or even you want a discount to your gym, the life is also a really great component of the resources for living. Legal is also a great feature. You can prepare a will on their website. You also have access to loads of legal documents and legal advice if you'd like. With tax season coming up, everybody, I'm sure, is interested in the financial assistance and the tax assistance, but they do have many financial components as well. It's one phone number here on the screen, and every phone call that's made is always free and confidential. The EAP also went digital last year, so if you're interested in texting with a therapist, that is also available if you're over the age of 18. So on average, 1 week of Talkspace messaging or text messaging equals 1 EAP session. If you're interested in learning more about Talkspace, we encourage you to call Resources for Living for authorization. We have a lot of mobile apps that can help break down barriers to care. They're displayed here on the screen. I personally have an ICUBA folder set up on my cell phone, and all of these apps are available to me in that ICUBA folder. So it's just a good idea to prepare yourself with the information that you need. So we'll run through these next few slides pretty quickly. Great news, these are the same great benefits will remain in place from the brand partners shown on the screen, and none of these existing plans will be changing for the coming year. So the ICUBA plan that UT offers is the premier, it should be the preferred PPO plan. So we will be updating the slide and we'll send that out to you. The ICUBA prescription drug plan, the 90-day supply, just as a reminder, will save you money. So as Just like in prior years, you do have the ability to have a 30-day supply through retail, or at retail or mail order, you can do a 90-day supply. So if your prescription is available for a 90-day supply, we really encourage you to fill that 90-day. We do have several prescription drug freebies. So if you have a prescription for any of the items listed on the left, these are always free to you. You just take your prescription to the pharmacy counter and they will be able to assist you. Also, as a reminder, prescription drug out-of-pocket maximum is here to protect you. So maybe you don't visit the doctor very much, so you'll not ever meet your medical out-of-pocket maximum. That's why we've included a separate prescription out-of-pocket maximum in case you're one of those people that takes a lot of medicine. The behavioral health and substance abuse benefits are also still available to you. This will be through Aetna. It's a branch under the medical plan as well. So if you need professional counseling beyond what the EAP provides you, the professional counseling is available. Any psychiatric medication evaluations, ABA services for autism, or those intensive services can all be rendered through the Aetna benefit. Humana Dental will remain the same. We're offering 3 plans: the high option PPO, a preventive low option, and a DHMO option. I will just call your attention to the preventive low and remind you that the preventive low plan does not cover major services or orthodontics. It only covers preventive and basic services. So if you need a cleaning or a filling, those are services that would be covered under the preventive low plan. However, nobody wants or plans for a root canal. So if you're going to need more extensive services, you may want to consider one of the other 2 plans. The DHMO is also still offered within the ICUBA book of benefits. And just as a reminder, you must have a pre-selected dentist within that DHMO before you seek treatment. The dentists are also only available in the state of Florida. So if you have dependents that reside outside of the state, they will either need to come home for dental treatment, or I would choose one of the other plans. The DHMO does provide that preset copay schedule. So if you have any questions on what is covered, you can always reflect to that schedule of benefits. We're still offering 2 vision plans. These are also going to be unchanged for this year through IMED. The base plan offers frames every 24 months, and then frames and contacts both come with a $100 allowance. And then the buy-up plan offers frames every 12 months with a $130 allowance for frames and contact lenses. So just be sure that you know what you're getting into when you select a vision plan. Last, we'll review the Symetra benefits. Through the University of Tampa, you're provided basic life and AD&D, and then you as the employee have the option of electing voluntary life, spouse life, or child life, which can all be done during the open enrollment period. And then, of course, short-term and long-term disability are also provided. Life and disability. If you do elect to increase your voluntary life at this time, and you are flagged that an evidence of insurability is required, you will receive this notice through our portal. There will be a single sign-on or automated pop-up from Symetra's secure portal when you complete your enrollment. This connection will only be initiated after your enrollment is finalized. It's really important that you complete the questions and submit your EOI to Symetra immediately following your enrollment period. If you don't know the answer to all the questions, it's no problem. Do the best that you can, and if Symetra has any questions on the document that you submit, they can always follow up with you, because this is the only time that you have to submit that questionnaire. So to finalize our presentation, we do have some open enrollment housekeeping items. Changes made during the open enrollment period will remain in place for the full plan year. This is an IRS regulation, which means that the benefits that you confirm this year will remain in place from April 1st, 2020 and end on March 31st, 2021. Any changes made outside of enrollment are only permitted within 30 days of a qualified life event. So if you have a baby or get married or have a loss of gain or other coverages, those are all considered life events. But you do need to be mindful that changes need to be made within 30 days. Just as an additional reminder, the 1095 tax form is not required again this year. So we'll be safely saving it for you in your employee file at ICUBAbenefits.org. But again, it is not required to file your taxes. All requirements of healthcare reform are in place. In fact, the ICUBA plans offer more generous free wellness benefits than are required by law. Now is also the time to review and update your life insurance beneficiary information. And just a reminder, when you're designated a beneficiary under the age of 18, you want to contact an estate planner or establish a proxy or trust. That concludes our presentation. Thank you very much for your attention. And if you give me a moment, I will unmute the lines for questions. Okay, the lines have been unmuted from my side. It looks like many of you have muted your own lines. So if you'd like to ask any questions now, you're free to ask away.
Rachel?
Yeah.
Will our members see an email or some communication from BSIP notifying them that open enrollment is open?
No. So because each school has their own open enrollment period, ICUBA will actually provide the school HR department sample email that you can then modify and provide to your own population.
Thank you.
You're welcome. Any other questions? I know that was a lot of information. All right, well, we will conclude the presentation. Thank you very much for joining, and if you have any questions, please let us know. Have a good day.